Hi folks, thank you for watching this video. Please subscribe my channel for more videos. Mom and baby at 33 weeks pregnant. Baby development with only 7 weeks to go until your due date. Your baby is growing fast in your womb. At 33 weeks of pregnancy, your little bundle of joy might weigh as much as 4.2 pounds, and he/she may be 17.2 inches long. Remember that your baby may weigh more or less than this. The weight and length of each baby is quite different, depending on many factors, such as genetics. As your baby gains more weight with each week that passes, he/she is quickly losing his/her wrinkled look. His/her skin is changing colors, from red to pink, as more fat accumulates underneath the skin's surface. At pregnancy week 33, your baby's fingernails are long enough that they reach the tip of his/her fingers. The fingernails are very soft in utero, due to your baby being surrounded by amniotic fluid, so don't worry about your little one scratching his/her precious face. Your baby's skeleton continues to harden, thanks to the calcium in your diet. However, the bones in your baby's skull aren't fused together yet, which allows them to move and slightly overlap so that he/she can easily go through the birth canal. The bones in the skull won't completely fuse together until your baby is a young adult, so that they can grow as the brain expands during childhood. By week 33 of pregnancy, your baby is swallowing almost a liter of amniotic fluid every day. This helps his/her digestive system develop. Your baby's nose is almost fully formed now. The bridge of the nose has formed, so your baby no longer has a button nose. The rest of your baby's face is also rounding out. A helpful tip: it's important for you to get enough calcium in your diet. As ossification occurs, the process of your baby's skeleton changing from cartilage to bone, your baby needs an increasing supply of calcium. If you don't have enough calcium in your diet, your baby will rob the calcium from your bones. This can lead to osteoporosis. So it's more important than ever for you to drink a glass of milk, or eat that delicious chunk of cheese. Mom's changes. Are you waddling yet? By 33 weeks pregnant, you are the largest you have ever been. Don't be surprised if you find yourself waddling around. Everything is becoming more difficult: sleeping, finding a comfortable position to sit in, and even walking around without bumping into anything. Your uterus is now more than 5 inches above your belly button, and you may have gained up to 28 pounds by now, or even more than that. Your pregnancy weight gain won't slow down anytime soon. At this late stage of pregnancy, many pregnant women find that they gain weight faster than ever before. This is because from here on out, most babies gain between 5 and 9 ounces every week. With your due date only 7 weeks away, you are probably giddy with excitement at the thought of soon meeting your baby face to face. As you think more and more about your labor and delivery, you might want to consider pre-registering at the hospital. Pre-registration will help speed up the admitting process once the big day comes. If you're like most women, you probably don't even want to think about filing out paperwork when you are in the throes of labor. And you probably don't want your husband or partner too far from your side, either. Have you packed your hospital bag yet? At pregnancy week 33, this is something you need to start doing as soon as possible. You just never know when you will go into labor, and you don't want to be rushing around trying to find things and pack when you're dealing with painful contractions. Speaking of contractions, you might be experiencing stronger Braxton Hicks contractions this week. Braxton Hicks contractions, also called false labor pains, become more frequent in the 3rd trimester. Sometimes, they can occur relatively close together, and they may even feel painful. You can sometimes confuse them with true contractions. It's not uncommon for first-time mothers to have a few false alarms and false runs to the hospital because of Braxton Hicks contractions. In addition to Braxton Hicks contractions at week 33 of pregnancy, you are probably also experiencing some edema or swelling in your ankles and feet. Your swelling will be worse if you live in a hot climate, or you're having your third trimester in the middle of the summer. You can minimize your discomfort by drinking plenty of water. Take regular breaks from sitting or standing, and resting on your left side as much as possible. At 33 weeks pregnant, it's also not uncommon for you to experience some achiness or numbness in your fingers, wrists, and hands. Like the other tissues in your body, the ones in your wrists can also retain fluid and swell, which can increase pressure in the carpal tunnel in your wrist. The nerves that run through this tunnel can end up becoming pinched and cause you to experience carpal tunnel syndrome. You may be able to ease your carpal tunnel symptoms by wearing a split or a wrist guard to stabilize your wrist. If you have to work in a job that requires you to perform repetitive hand movements, remember to take breaks to stretch out your hands. Fun fact: if you're still feeling quite sexy this week, it's perfectly safe for you and your partner to have sex right up until your labor starts. But only if your caregiver has not warned you against it, and if your pregnancy is low risk. Pregnancy 411 Recognizing the signs of labor. Every woman's labor and delivery is unique. While some women experience very distinct signs of labor, others do not. Some women have quick deliveries, while others may labor for hours, and even days, before their baby is born. You may have very painful contractions, while the woman in the room next to you experiences little discomfort. Signs of labor include lightening in the weeks, or even hours, before labor starts. Your baby will drop into your pelvis. This process is called lightening, and it's a sign that labor is just around the corner. Bloody show. As you get closer to labor, you will pass your mucus plug. The plug may come out as a lump, or increased vaginal discharge over the course of several days. Your vaginal mucus may be tinged with pink, red, or brown blood. A bloody show. Unfortunately, losing your mucus plug doesn't mean that your labor is imminent. You can lose your mucus plug days, or even weeks, before you deliver. But it is a sign that your body is getting ready for labor. Contractions. While the sign may seem obvious, contractions are a universal sign of labor. Contractions may feel like a cramping or tightening sensation that starts in the lower back and moves around the front. Some women describe contractions like a strong menstrual cramp. Sometimes, you can confuse Braxton Hicks contractions, false labor, with true labor contractions. One huge difference between the two is that Braxton Hicks contractions will stop once you move or change position. True labor contractions continue no matter what you do. They also come at regular intervals, and they get closer together and last longer as time passes. They also grow in strength as time passes, so they often become more painful with time. Your water breaks when the fluid-filled amniotic sac surrounding your baby ruptures, also called your water breaking. This is a telltale sign that your baby will soon be born. When your water breaks, it may come out as a large gush of water or a slow leak. Most women have regular contractions before their water breaks, but sometimes their water breaks first. In some cases, your water may break but you don't experience any contractions. If this is the case, you will need to have your labor induced to protect your baby from infection. The amniotic sac has protected your baby against germs throughout pregnancy. Sometimes, your doctor will have to break your water to get labor to progress. Toward the end of your pregnancy, your doctor or healthcare provider should give you guidelines on when to head to the hospital. Your instructions will depend on your individual case, whether you are low risk or high risk. In most cases, if your pregnancy is low risk, your caregiver will probably want you to wait to go to the hospital until your contractions come about every 5 minutes and last for about a minute. But don't hesitate to call your doctor if you are having any signs of labor. You want to be safe rather than sorry. If this is your first pregnancy, you probably will have a few false alarms, and that's okay. Don't be embarrassed if you are sent home. Think of it as a practice run for the real deal. Hi folks, thank you for watching this video. Please subscribe my channel for more videos. Mom and baby at 33 weeks pregnant. Baby development with only 7 weeks to go until your due date. Your baby is growing fast in your womb. At 33 weeks of pregnancy, your little bundle of joy might weigh as much as 4.2 pounds, and he/she may be 17.2 inches long. Remember that your baby may weigh more or less than this. The weight and length of each baby is quite different, depending on many factors, such as genetics. As your baby gains more weight with each week that passes, he/she is quickly losing his/her wrinkled look. His/her skin is changing colors, from red to pink, as more fat accumulates underneath the skin's surface. At pregnancy week 33, your baby's fingernails are long enough that they reach the tip of his/her fingers. The fingernails are very soft in utero, due to your baby being surrounded by amniotic fluid, so don't worry about your